got the whole, that's like the person that says you're doing the class on Saturday because
Music's coming down. You're on. Yep.
Go.
I was looking at the,
Stop looking at it.
Don't look at it.
Oh, don't look at that.
Change.
welcome to Saturday, January 16th, 2016. It is me, live, Dr. Ken Davis, coming to you from Modern Metro Studios, Rockland World Radio. You are here, and this is the Natural Force Healing class review, new research, and new teaching of the SPIL line, sagittal pain indicator line. So take a deep breath, you made it. And let's give you some ground rules and how to be proactive in the class today. So first of all, we had some call-ins already of a little bit of confusion. So number one, you should all obviously be on the homepage of Rockland World Radio, and in the upper left corner there is a tab called the chat room. So go click on that and enter into that and put a username in there. Also, it'd be a good way to know who's watching me right now, so that if there's someone that's part of the program that's not here, we can call you and contact you to find out any issues that you may be having. So please communicate with us right now and let us know that who you are and that you're with us and watching. So go to the chat room, click on it, enter into, once you do that and create a username, then click on the lobby, and then you'll be able to communicate, chat through your computer. Also, there is a live open line that you can call in and ask me questions directly in the studio here as we go through the material today. What's that number again, Rich?
845.
845
353
353
2910.
2910. 353 2910. 845 is a direct line into the studio. I'll hear you. And I'll be able to answer your questions or go over anything. This class is for you. This is a review class, as I mentioned, of Natural Force Healing. We're going to cover some new material, and we're going to teach you the SPIL line, which actually I'm going to do first today. There are those that are in the program here today that are not familiar with the Natural Force Healing work. But we'll cover some interesting things about that and expose you to it. And but we're going to begin today with the SPIL line. Also, the way we're going to flow today is we're going to do the class today in 1 hour sessions. So also this will be for our taping and recording. So it'll be 1, 2, 3, 4. Give you a break at the end of an hour, and let you stretch and take a deep breath and digest the material. And then again, the class material, the recordings will be made available to you. That's part of your tuition. So apart from your manuals, PDFs that you should have received, if anyone didn't, please let us know and we will get that to you. And then you'll get the recordings of the class. Okay? Okie dokie. Also, I do want to say this as well. On our, for those that are not familiar with Rockland World Radio and the fact that I've had a radio show on Rockland World Radio called Creating Health, Mind, Body, and Spirit since 2009. Now, I haven't, because of my schedule, my teaching schedule, especially over the last 3 years, I haven't done as many live shows. But there's over 100 archived shows on Rockland World Radio. Now, there are shows on there that you should go to and listen to them on. I have, not only are there shows on spirituality and awareness, and Lisa Davis has done shows also on there. There's shows on natural force healing that you should listen to. There are shows on cranial technique. There are shows on contact reflex analysis with the late Dr. Versendahl. There's one. There are shows on thyroid, visceral manipulation, bloodless surgery, nutrition that supports superbugs, infection, viruses. Peruse through the archives and listen to those shows. They're phenomenal. I must say so myself. A lot of times I listen to my own show and says, is that me doing that show? They're great shows. And they're also educational in regards to your patients, that you should educate them with the material that the shows are talking about. There's a phone call in.
Refresh.
We okay?
There's a circular thing in your browser.
So please review those archives and check it out.
Yeah.
Okay, so in the initial class that we're going to have today on the SPIL line, sagittal pain indicator line, this technique can be implemented and utilized, first of all, if you're a practitioner, chiropractor, acupuncturist, massage therapist. This technique primarily can be utilized in any technique or procedure in which you're using in your skill set. So it fits nicely into whatever it is that you're doing right now in your practice. If you're a body worker or an energy healer or whatever, again, it could be used. You may find that you learn this material, you won't want to do anything else because it's that powerful that it clears everything out. Or again, if you are a vibrational therapist, body worker, massage therapist, again, it fits really nicely into what you're presently doing. But like anything, you have to do it. And you have to utilize the material that you're learning. And you have to practice. And you have to practice. I was telling my associate, Kristen, last night, over the years, I've been paralleling teaching with to my students with my own student nature of being a musician. Now next week I have another program I'm going to be playing at, a gig in Brooklyn, New York. And I was in the studio with my teacher yesterday, and I'm going to be doing 3 songs or accompanying some singers on the organ, and I'm going to be doing my own thing. And when I went to his studio to practice yesterday and take a lesson, I had wanted to do this other song for a long time. So to me at that point, 3 songs, and which is not easy to learn, and then I'm going to show up there next Friday night and play with this professional band and guys that I haven't even played with before. So I got to learn it, and then I got to do it, and then I got to accompany someone in front of a live group of people on stage, and then play with this new band, which I've never done before. So I wanted to have more. I said 3 is not enough. I want to have more. I want to play more songs. And what he told me is what I tell you. The tendency in learning today and over the decades that I've been involved as a teacher and sharing information that I've learned is that there's always a tendency for the student and the practitioner to want to always take something, learn it, and then not stay with it. Or they take a class, or they take 2 classes, and then they think they own it and they have it, and they're off on the next thing. Now, I'm not saying that we don't want to continue to learn and to grow, but I've mentioned over the years many times of the tendency to want to move on to the next thing and not be patient and learn and master what it is that you're presently doing. Now, I've said also, teaching over the years, that I don't really care what you do in your practice or your life, but be the best at it. So if you're a physical therapist and you do that, be the best at it. If you're a nutritionist, be the best at it. Believe it, learn it, and then educate your people to what it is that you do. So getting back to the parallel, was that what he told me, my teacher Nate Shaw said, you don't need more, you need to go deeper. So it's not about having more, it's about going deep. And when he said that to me, I realized it's what I tell you. It's not always about having more technique, because, our nature. I like it. Over the years, I like to learn more, as you know, and receive information and all this. But it's about going deeper and mastering the depth over what it is that we've already learned, especially in the natural force healing work. Those levels of work that have been given over the years were given to us because all that I learned over those 35 years, especially when Lisa left the office, was that I depended upon her as in her gifts to be able to provide me the knowledge and the information so that I didn't have to think. I was just the energy guy to bring the energy through. But those levels are all encompassing of all that I learned, so that we think that, okay, we put our hands in a certain area and those energies come in, and then it's not enough, or I'm not doing anything, because in reality you're not, per se, which is what I've tried to hammer home to you over all of those that are on the program today that have taken natural force healing, and even the other things. You're the conduit. There's the light, and then there's the switch in the wall, and then there's a cord that connects the two. You're the cord. Then you have the patient or the client there. See, the tendency is that we think that we're doing it. And then we get all bent out of shape and all worried and all this and that, thinking that, well, I didn't do a good enough job, or I'm missing something, because the person doesn't respond the way we want them to, or the problem still continues, or whatever. In general, we're just the conduit. We're just a vehicle. And as I've, again, asked you to remove your mind long enough so that you can receive the information and receive the power of the work, so that you can amplify it. Again, one of the things about what you're going to learn in the SPIL line, and also in the review of natural force healing and some of the new material today, is the fact that what separates our system from the other systems that are out there, I've said it a million times, is the ability to take these energies and amplify it, to allow us to be the amplifier of the energies who are only wishing to nurture and please us. But they need amplification when they come into our realm of reality, again, as I've talked about many times. It's like receiving, again, a radio signal from wherever you are right now into Rockland World Radio. You need a receiver to pick it up, right? The point is, the more you get your mind in the way of the process, the more you interfere with it. And then we get into all that head chatter. Oh God, this, that, what about this? What if I miss it? What if it's not good enough? What if my hand's not in the right position? What if this? What if that? That's mind chatter. You need to stop it. And it takes practice. And it takes the ability to also remove yourself from all your stuff that you have. If you're a healer working on people, doesn't matter whether it's your family or patients or whatever it is, you have to leave your baggage outside when you walk in to do your work. And then you should do it again before you start in your afternoon hours if you work that way. Doesn't matter what job you are, it doesn't whether you do healing work or whatever. Could be working in the laundromat. Be the best at the laundromat. Leave all your stuff outside. You know, I was mentioning when I was teaching the ENATE, our ENATE system, Energetic Nutrition Assessment Technique, I was also talking about this yesterday. When I first started teaching, I always, as you know, I always try and talk about the ability to be present, to be in the moment, and not be thinking about what you're going to have for dinner at night. So when I started teaching in Seattle a few years back, my guitar hero, again staying on the course of music, is Eric Clapton. So I took a video with me before I started the class, and you know, as we're warming up and introducing everybody and finding out why everybody's there. And I played Clapton doing a guitar riff when he was with the Cream reunion back in London in 2005. Now, Cream was a super group back in the late 60s. 3 guys, unbelievable. So I showed Clapton playing a guitar solo in the middle of, in London at the Royal Town Hall where they played 40 years earlier. The point I'm making is that when you watch, and I wanted the audience to look at Clapton play and be present in his ability to play that guitar, so present in the moment, almost like he's channeling the energy and the music through. He's totally present in what it is that he's doing. Not thinking about what's going on yesterday, or he's totally there on stage with the other musicians. That's how we have to be. Totally present in what it is that we're going to be doing and connecting to it and then doing our thing. And then it's easy. Then it's easy. So we want to stay within that framework today as we learn this material and whatever. And again, getting back to being a conduit, when we get into the SPIL work, you're going to find that even more importantly is that when I teach you how you're going to be a vehicle initially to shunt, S-H-U-N-T, the energy or the stream of energy from certain points along the sagittal suture to points on the body, you're shunting the energy through you. So you really need to be clear in your connection, which we'll go through. Okay, so again, feel free to ask any questions or comment through the chat or to call me live in the studio for your comments or insights, feelings, or whatever, okay? Now, so we're going to begin today with the SPIL line. And you should have received a PDF file of about how many pages? 40-something pages in your manual. SPIL line, sagittal pain indicator line. Now, this work I've never taught before outside of my practice. It encompasses or is a part of a body of material and information that my mentor and teacher, Dr. M.L. Reese, developed going back in his career through a family of diagnostic and assessment indicators, with the SPIL line being one of them. The biggest thing and why this is so powerful is that your thoughts, especially in your clients and your patients, determine their reality and their ability to get well and what sets up their illnesses and conditions in the first place. Their volitions, their thinking patterns. Now remember that the mind, especially subconscious mind, is just like a imprinting movie screen. It's neutral. It receives imprints and messages that the conscious mind, who is the great deceiver, the conscious mind never tells the truth. It thinks it does. And it just imparts the imprint or the message to the subconscious mind, which records it like a movie screen. So, for example, at age through your childhood, if someone was telling you that you're ugly, you're ugly, you're ugly, you're ugly, you're ugly, and then all of a sudden, as you grow, you realize that I'm not. You're beautiful, or I'm pretty. The imprint on the screen of the mind, subconscious mind, may be so powerful of that imprint that no matter what you're telling yourself, it negates it. It negates the response or the command or the message that I'm pretty. So the SPIL line primarily is working with changing these negative volitions or emotions to positive again. That you're going to assist your patient, client, whoever, with family member, and turn it around and bring health and well-being back to their being. So through the SPIL line, you're going to be able to not only change their structure, if you're a chiropractor, without even having to change the structure, because their structure will change by changing the SPIL points. You can absolutely change their biochemistry. You can alter their physiology, bringing it back into balance. You can also, through the SPIL, be able to put nutrients and foods and even medication, if you wanted to, which we researched many years ago, on points in an area called Kasky Circle. We're going to go over this in depth. That actually the patient can benefit from a positive aspect of the med if it clears the SPIL point out. So you can actually put medication on points along the Kasky Circle, what's called gateway points, and have positive benefit from meds if it clears the SPIL point out. Same with nutrients, same with foods, and other things. We're going to discuss that today. It's very powerful. So it's important in your ability with your patients and clients to be able to, first of all, evaluate the component of this positive negative output in the mind and turn it around so that you can lead your patient back to health and well-being. Because in my experience that over the years, it doesn't matter what you give them. I don't care how many supplements you give them and how many sometimes spinal adjustments they get and all of this stuff, which is important when it's indicated. But if there's a heavy-duty mental and emotional pattern, it's not going to make the change. They won't respond. For example, one of the things of research we're doing, we believe 100%, but we're not really legally allowed to say it, is that in the high 90s, all these gut issues that are so prevalent in functional medicine today, and everyone's doing webinars on them and all of that, it's all emotion. All these gut issues that develop through the gut, intestine, biofilm, all of this stuff comes from the emotions, an emotional gut issue. And if you change the gut issue emotionally, it's miraculous. We have a young girl, for example, that came in. She's been a patient of mine since she's this big. She's now in college. I hadn't seen her for a while. This is a couple of months back, and she had irritable bowel syndrome, colitis, right? Ulcerative colitis, right? Been all over, was put on cortisone, whatever, and taking all these drugs and medications. And she came in one time. She had an emotional gut issue. We changed her emotional patterns around and gave her a little bit of support just to heal it up. One visit. And she had been bleeding terribly and trouble for months. That's how powerful the work is. But also, you have to have a methodology to be able to evaluate the person. Some way to talk to the innate intelligence of the body. We'll talk about that. Also, too, those of you that are listening to me today, remember that I'm biased. I'm teaching you through my own bias of what I've learned over 40 years and what I've learned from a master. So as a kid, I was exposed to somebody that was a genius in his ability to understand the physical, mental, emotional, spiritual ills of a human being. So I always have that bias. I always have that in my evaluation of the patient. No matter how much I learn about nutrition or food or diet and all these other things, or blood chemistry or saliva testing or stool, my foundation has not wavered in what I've learned from my teacher, which is this triune or triangle or triune model of health, which I'll talk about in a little bit. Back in the 60s, Dr. Reese, my teacher, who has many credentials behind his name, one of them being a certified craniopath. He also has a postgraduate degree. Now he's a chiropractor, of course, to begin with. He has a postgraduate degree in as a diplomate in chiropractic orthopedics, a craniopath, founder and developer of soft tissue orthopedics. He is also the developer of what's called etheric modification therapy, better known as harmonics, and was chiropractor of the year. He was a sacral occipital technique instructor, certified, chiropractor of the year in Omaha, Nebraska in 1966 and 1967. And in 1963, at the Aladdin Hotel in Las Vegas, he was at an SOT, or Sacral Occipital Technique Conference, with Dr. DeJarnett, and in the clinic there. The doctors always put together a clinic. And he had a little problem with his ear, and he was given an adjustment to the skull, to the temporal bone, and when they worked with his skull bone, he found that it fixed the problem that he was having in his ear, and also related to his hip, his pelvis. So from that, always being a researcher, he figured that there has to be something to the side plate bone of the skull. Has to do in a way in which the body communicates through it. So at that time, Dr. DeJarnett, the founder of Sacral Occipital Technique, had been doing research on the temporal bone and as it relates to the organ systems and systems of the body. But he had just started, and knowing that Reese was this incredible researcher, he handed off the research and the material to Reese to investigate. So through this process of having this direct experience in this SOT clinic and being helped, he realized that there was a lot to the side plate bones of the skull, called the temporal bone, along with the sphenoid bone, which is your temple area here. So here's your temporal bone, sphenoid bone. We get a clip picture on that. Also, too, Kristen, if we get close to the hour time, we want to stop, right, Rich, and take that break? Okay. So, what Reese found, and I'm leading to the SPIL because this is a diagnostic family, so that you understand the background, especially when we talk about alpha state, because the alpha wave is very important and a vital ingredient of the SPIL line technique that you're going to be learning. So Dr. DeJarnette handed off this research project to Dr. Reese back in the 60s. And what Reese found was that the side plate bones of the skull, which led to the development of the temporal sphenoid, or the TS line. Now the TS line is one in the family of diagnostic and assessment indicators that Reese developed. The SPIL line is one. So the TS line is one. The sagittal pain indicator line is another diagnostic line or points. I'll come back to the TS in a minute. What's called the AIM line, anatomy, impression, memory line. He developed what's called a self-salt line. He developed a head gravity line. And those are major diagnostic indicators that you can learn how to do. The SPIL line is very powerful. And that's why I wanted to bring that out. I felt it was time for individuals to begin to learn it. So getting back to the TS, what Reese found is he began to explore these interesting side plate bones of the skull, temporal and the sphenoid bone. Also, again, Reese in his background was an electronics wizard since childhood. And he actually, a lot of people don't realize that he was the forerunner and the developer of the vacuum or the television tube. You know, remember the television with the big tube sticking out the back? He helped develop that. So he used a lot of, in those days, a lot of electronic devices for scanning and documenting things, and he used infrared photography and whatever. So what he found also is that, and he used oscilloscopes a lot. So he did a lot of research where he would hook up his patients to an oscilloscope, which is really the forerunner also of the electroencephalograph that are, leading to all the things in the technology today. So what he began to work with and find, he started to look at the different brainwave patterns that were on an oscilloscope and found, we'll come back to the side plate bone in a second, that one of the waves, called the alpha wave, was the most easy and largest brain wave to track and to find when he began to study it with patients. Now, getting back to the side plate bones, as his research continued, he began to find that points along the skull started to relate to, he traced it to points in the body, most of them on the front of the body in the soft tissue, in the abdomen, where points would become sensitive and tender as it related to various organs and systems of the body. So that when an organ was in trouble, or a system was in trouble, it calls forth or it craves out to the brain and says to the brain, please, I'm in trouble. Send me more life force. Send me help. Send me more energy so that I can be revitalized and resuscitated. Now, a great analogy today is when your phone is dying. So you take your cell phone and you charge it, right? And you hook it up and you put it into your wall, right? And it's supposed to charge. Every night when you go to sleep, you're supposed to be recharged. Every organ, system, gland, and tissue of your body is supposedly recharged, provided it's hooked in or has the vehicle to be able to receive the energy. So again, what happens is when there is a soft tissue, organ, viscera in trouble, it calls out to the brain via the side plate bones of the skull that acts as a circuit board. So what I want you to understand is that the temporal bone and the sphenoidal with it is a circuit board. So that when the organ's in trouble, it sends a message through the board and then up to the brain and mind to send more life force through the body's electromagnetic field to points on the body called entrance points. Say it again. When an organ, tissue, or system is in trouble, it sends a message through the circuit board, through the temporal bone, sphenoid bone, up to the brain. Please send me more life force. I'm in trouble. Now, what Reese found is that each particular organ, gland, had a particular nodulation point along the perimeter circumference of the temporal bone and sphenoidal bone, about a finger width away from each other, that would nodulate or swell. And here's what people throughout the world, doctors, supposedly AK practitioners, SOT, have no idea and really don't understand the significance of this process. That these points are nodulating to try and get, in a way, to get the brain to amplify, to get more life force to that part of the body through the entrance point. That's why they nodulate. They swell. Okay, I'm going to try and get you more there. I'm going to tell the brain to send you more there. So Reese correlated this perimeter circumference with each particular organ, gland, system. That related to all the organs, also relates to structural components. I'm not going to talk about that today. You can learn that. We teach this work throughout the United States, the TS work. But again, not to tout my own horn, but I have all of the archive material and I've researched all of this and gone into the depth of it. And I would affirm that I would probably consider myself the world authority on TS evaluation and diagnostics at this point. I don't think there's anyone that understands the depth of it, of what I've explored through looking at all his manuals, his tapes, his books, and really going deep into understanding what he developed and found and how powerful it is. And also why nutrition or nutrients in the initial stages of his research and work with the TS and also with the SPIL really did, which we'll talk about in a minute. So again, to hammer home the point, when an organ, system, or gland is in trouble, there will be a reflex area, most of it in the abdomen and the front of the body, called entrance points, that become tender and active. Sends a message through the body's electromagnetic field through the circuit board of the skull, temporal sphenoidal, and then up to the brain to send more alpha wave. Remember, the alpha wave is a healing wave. This is the wave right before we fall off to sleep. That relaxing, tranquil state, or what we know as the REM state, rapid eye movement. So again, the organ in trouble sends the message to send more alpha wave to a point that each organ has related and been researched. In the SPIL work, we're going to talk about Kasky circle. We'll get into that in a little bit. To send more message there, more life force, more alpha to resuscitate and revitalize that organ that's in trouble. And it sends it through the body's bioelectric or electromagnetic field. Now, in the SPIL work, you're going to learn that those emanation points, or where it's sent from, where the TS is the side plate bones, the temporal bone, and the sphenoid, in the SPIL work, it's from the sagittal suture. The suture on the top of the skull, which I'll show you in a minute. So the life force, or the stream of energy, called etheric energy, which we'll talk about, in the SPIL work comes from the sagittal suture. Here's what happens. Well, even before that, when you sleep at night, Every individual, every human being is supposed to have about 4 to 5 states of REM, rapid eye movement state. Now, as you know, we live in the United States, wherever you are, no one in the United States sleeps. There's a real sleeping problem, so everyone's not getting up in the morning feeling like a 10, feel like a 0 as far as energy goes, because you're not being recharged, because you're not getting enough alpha wave. You have to have alpha. And if you don't, then your organs and tissues are not going to be regenerated, and you're going to be in trouble. So the alpha wave and REM is very, very important. Now, what happens when going back to the organ, staying with the TS for a minute, when that organ or tissue or part of the body or system's in trouble, and it cries out to get more alpha there by going to the circuit board and activating a nodulation point, the nodule swells and amplifies, and the brain actually will increase amplitude by 10-fold to get more energy to that part of the body that needs it. But here's what happens. As it gets the message through the circuit board up to the brain to send more alpha, the mind-brain, body-brain connection to the body has forgotten the pathway. It's like, I don't know how to get home. I want to go home, but I don't know how to get there anymore. Now, unless you have a guidance system, you ain't getting there. And you become the guidance system. Meaning that you as the practitioner teaches and guides the alpha wave in the direction to the proper point that the body needs in that area to reestablish the connection to bring more life force there. It's very powerful. Very, very powerful. So again, the brain mind wants to send energy there, alpha wave, but forgets, doesn't know the path. You have to retrain it. And then you can teach people how they can do it themselves. You become the vehicle to retrain it. This is what the work is all about, the SPIL work. Very powerful. Also, the innate wisdom of the body, what we as chiropractors call innate intelligence, you may call it whatever you want to call it. That intelligence knows how to direct energy and stream to parts of the body. Now try and keep this simple, you understand what I'm saying. This innate wisdom, that wisdom that knows to take your food and digest it, it knows to send red blood cells down when you have a cut in your leg, and it knows how to send that energy to do that, but it does not know how to take an organ, for example, that's not moving, or a scar that's not moving, or the fact that we stand upright fighting gravity every day. So it cannot take an organ that's in trouble and move it back into position. That's where the visceral bloodless surgery work and techniques come into play, where the practitioner has to learn how to become a bloodless surgeon or a visceral manipulator to reposition an organ that's in trouble. And there's techniques and procedures and classes that we teach to do that. But it can redirect, if you direct the energy properly, the innate wisdom of the body, which is what the TS work and all these family of diagnostic and assessment points do. That you act as a shunt to help it along. When in the old TS work, getting back to nutrition, which is so big today, everybody's given everybody a million supplements for one thing or another thing. Well, what Reese found, see, in the early days of the TS work, there wasn't 20,000 different supplement companies. There was maybe 5 supplement companies, and one of those companies was Standard Process Labs, which are still around today. Now, around the TS point, getting back to the TS, there are 16 specific areas or reflexes that relates to organs and tissues. So what Reese found was that, utilizing Standard Process, he used 16 particular nutrients that he researched. Why did he use them? Because he found one for each particular organ system, so that when a person took it and put it even on their tongue without chewing it, it increased the alpha wave amplitude by up to 10-fold. Meaning that when he correlated the nutrient to the circuit point relating to the organ, and that nutrient that he figured out was the right one for that organ, when the person put it in their mouth, it increased the amplitude and the energy of the alpha wave by up to 10 times. So there was times where working to reshunt or shunt the alpha energy to the area of the body with the nutrient was phenomenal. And the person went on to heal, just with the nutrient and the redirection of alpha wave energy. So we have maintained in our practice and work over the years that the reason we utilize really nutrition as part of our practice is more to give the person the nutrient to increase the amplitude and the energy of the alpha wave and the healing wave to that part of the body that needs it. Something that's really kind of revolutionary that a lot of people don't realize, especially doctors that are utilizing nutrition today. Because what's needed by the body for nutrition, if we were, you've heard and read stories about, avatars and yogis and ascended people that don't eat anything at all and live on air. Now, there's not many people in the world that do that, but it's possible. So what we're getting at is that what I'm trying to teach you in all of this work, it's about energy and vibration. If you break the body down into its molecular structure, all it is energy and information. It's all it is. It's just energy. But illness and dis-ease and discord is discordant vibration and frequency. It's really what it all comes down to. So you want a food or a nutrient is a vibration and a frequency. Illness that I learned in doc 40 years ago from Dr. Rees, what you see manifesting today as degenerative illness conditions is discordant vibration manifesting as whatever. So we've gotten away from what it's really all about. You have this, you have that, you have this, you have that, you have this. You have to come back to reality here of what's really creating it. Discordant harmony, the piano being out of tune. Tune the piano back, makes nice music. Now there's many things that can do that tuning. Food is one. Attitude is another. Sound is one. Color is one. Frequency, tone, harmony, chanting, meditation. Point is, how do you know which one is the one that's right? Now, I'm not trying to go off on a tangent, but I'm trying to get you to start thinking different, especially in the way you work with your patients. So I would invite you to learn the TS work as well. It's really powerful, but I'm giving you this background so you understand what it is, because when we go into the SPIL work and we're working with these negative volitions and streaming it and shunting it, you're really you're going to be working with alpha, working with the alpha wave as well. So, again, that's the development of the TS. And Rees began to investigate all these different points on the skull. Sagittal, the coronal, this is I'm okay, right, Rich? All right, so again, here's a sagittal SPIL we're going to be doing. Then you have the lambdoid suture. So for example, each of these points correlates to cell salts. Cell salts are needed to create color vibrancy in the body's aura. Then there's the aim line, it's not on here, the aim line runs here, this 11 points. And the head gravity line along the mastoid. It's really amazing, the amount of research and material that he did. So if you want it one day, I'll teach these too, if you want me to. You let me know. If you like the class, you'll let me know if you want me to teach the other things. Okay. I want you to master the SPIL line, what we're going to do today. On the SPIL line, we'll get into that, just to give you a little summary of it. There are 12 particular points that you're going to evaluate and examine. They begin, you have to have some anatomy. Simple. We all know what the soft spots are, right? As a baby, we have one here, we have one in the back. So the first landmark we want to learn is what's called the bregma. The bregma, B-R-E-G-M-A. The bregma is the joining of the sagittal suture to the coronal suture. You follow it back along, it comes to another landmark. So those listening in, put your hand in the back of your head and you'll feel, and everyone feels different. You'll feel a little soft spot there in the back. It's an indented area. Some of them feel higher, some of them feel lower, some of them feel in more, some of them feel back. You'll find it. That's called the lambda, L-A-M-B-D-A. Okay? Lambda. Now the lambda is the joining of the sagittal suture to the lambdoidal suture in the back. So along the sagittal line are 12 that begin right in back of the bregma. Right in back, about a fingertip away from each other. There are 12, and with number 12 ending in, right in front of the lambda. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Those are the SPIL points. Each one of those SPIL points relates to a volition, an emotion, positive and negative. Each 12, and this is in your manual. We're going to go through this. Also, in your manual, I have in there the levels of the spine that become involved or subluxated or distorted when there's a SPIL problem. That's why I said if you trace that out and fix the SPIL, go back and check it, it may not be there anymore. Because the structural relationship is a manifestation of disturbance and emotion, not the cause, an effect. That's why one of the things I've heard over the years, right, from patients that come from other doctors, not that they don't do a great job, is that, I get an adjustment and it lasts about 3 days and it feels good and then it doesn't last. I got to go back and get it again. And I'm going 3 times a week forever. When's it going to stop? I go 3 times a week, doesn't hold. And all on and on and on and on and on and on and on. Because you're fixing an effect. Now, we want to fix the effect when it's indicated to fix, but we got to fix the cause. Now, in this case, the SPIL line or the volition is the cause. Talk more about the triune model of health, especially when we get into the natural force healing review. We'll talk about it in the SPIL work too. Okay? It's about that would probably be a good time. So we're going to take, it's 1 o'clock now, we're an hour into it. We're going to hold off and tape. So take a break, take a deep breath.
Just 2 minutes, really.
2 minutes, send a question, chat with me. Whoever's not there, chat with me. Send me a message if you're not there.
Also, they might have to refresh.
refresh their computer?
Refresh the screen.
Refresh your screen.
if it's not already.
I'll see you in 3 minutes.
There you go.
What's up?
I just turned down the page that has the, so you have it.
Okay, I'm gonna do that one.